For over a century, scientists who wanted to study Egyptian mummies faced an impossible dilemma. To see what was inside the wrappings, to examine the body and discover the person's age, health, and cause of death, they had to unwrap the mummy. But unwrapping meant destroying 3,000 years of preservation. Once exposed to air and light, mummies that had survived millennia would begin deteriorating immediately. The linen wrappings, often containing valuable amulets and inscriptions, would be discarded as trash. Victorian-era mummy unwrappings were public spectacles, entertainment events where wealthy patrons watched as ancient bodies were stripped and dissected with no regard for preservation. Countless mummies were destroyed this way, their secrets lost forever. Then, in the 1970s, medical technology changed everything. Hospitals began using CT scanners, computerized tomography machines that could create detailed three-dimensional images of the inside of living patients without surgery. Forward-thinking Egyptologists realized this same technology could revolutionize mummy studies. If you could scan a living person's internal organs, why not scan a dead pharaoh? The first experimental CT scans of mummies were performed in the 1970s and 80s with limited success. But as technology improved dramatically in the 1990s and 2000s, CT scanning became the standard method for studying mummies. Today, museums and research institutions around the world use state-of-the-art medical CT scanners to peer inside ancient Egyptian mummies, revealing secrets that would be impossible to discover any other way. The results have been shocking, rewriting what we thought we knew about ancient Egypt, solving 3,000-year-old murder mysteries, and even revealing that some famous mummies contain no body at all. How does CT scanning work on a mummy? The principle is the same as scanning a living patient, but the challenges are unique. A CT scanner uses X-rays to take hundreds or thousands of cross-sectional images, slices, of the object being scanned. A computer then reconstructs these slices into a detailed three-dimensional model. When scanning a mummy, the process must be extremely careful. Mummies are fragile, sometimes over 3,000 years old, and cannot be jostled or handled roughly. Museum conservators work with medical technicians to position the mummy safely on the scanner bed, often still in its coffin or protective case. The scanner takes images at incredibly fine resolution, sometimes slices less than 1 millimeter thick. This allows researchers to see not just the skeleton, but soft tissue that has been preserved through mummification, internal organs, brain tissue, if any remains, and even the contents of the digestive system. The scans reveal details invisible to the naked eye. Hidden amulets placed between wrapping layers appear clearly. Jewelry embedded in the wrappings can be mapped precisely without unwrapping. Damage from ancient tomb robbers who ripped through wrappings searching for gold becomes visible. Modern researchers can determine age at death by examining bone development and tooth eruption. They can identify diseases by looking at bone deformities, calcium deposits in arteries indicating heart disease, or changes in bone density from cancer. They can see healed fractures, evidence of injuries sustained years before death. They can identify cause of death in cases of trauma, broken bones, or sharp force injuries. Perhaps most remarkably, they can create accurate facial reconstructions by measuring skull dimensions and using forensic techniques to rebuild what the person looked like in life. The technology has become so advanced that researchers can now virtually unwrap mummies on a computer, digitally removing each layer of linen to see why. One of the most shocking discoveries from CT scanning solved a 3,000-year-old murder mystery. Ramses III, who ruled Egypt from 1186 to 1155 BC, was one of the last great warrior pharaohs. Historical papyrus documents describe a conspiracy in his harem, where his secondary wife Tai plotted with palace officials to assassinate him and place her son on the throne instead of the legitimate heir. The papyrus says the plot was discovered and the conspirators were executed, but never clearly states whether Ramses himself was killed or survived. For centuries, historians debated what actually happened. In 2012, a team of Egyptian and Italian researchers performed CT scans on Ramses III's mummy, which had been discovered in the 1881 royal cache. The scans revealed something horrifying that had been hidden beneath the wrappings for over 3,000 years. Ramses had a deep, gaping wound across his throat, severing his trachea and major blood vessels. His throat had been cut from ear to ear in what was clearly a fatal attack. The embalmers had tried to hide the wound by placing an amulet over it and wrapping the neck especially thickly. But the CT scan saw through the wrappings and revealed the truth. Ramses III was murdered by having his throat slashed, most likely in the harem conspiracy described in the papyrus. The scans also revealed something else bizarre. Resting at Ramses' feet, also wrapped, was the mummy of a young man in his 20s. DNA testing and CT scans identified him as Penaware, Ramses' son by the conspirator wife Tai. The young man's mummy showed evidence of a violent death, possibly strangulation or hanging. Historians believe he was forced to commit suicide as punishment for being part of the conspiracy to kill his father. Father and son, murderer and victim, were buried together for eternity. Tutankhamun's mummy has been CT scanned multiple times, and each scan reveals new details about the boy king's short, difficult life. The most comprehensive scan, performed in 2005, created over 1,700 digital cross-sections of his body, producing a complete three-dimensional model. What the scans revealed was tragic. Tutankhamun suffered from multiple genetic disorders caused by generations of royal inbreeding. His parents were full brother and sister, both children of Pharaoh Akhenaten. This close inbreeding had devastating consequences. The CT scans showed Tutankhamun had a severe club foot. His left foot was deformed with the bones fused at an awkward angle, making walking difficult and painful. This explains why over 130 walking sticks were found in his tomb. He needed them. The scans also revealed he had a cleft palate, though this had been partially corrected, and spinal deformities, including scoliosis. His skull showed signs of temporal lobe epilepsy. Genetic testing found he carried malaria parasites in his blood at the time of death. His immune system, weakened by genetic disorders, would have made him vulnerable to infections. For decades, people speculated Tutankhamun was murdered because his skull showed damage. The CT scans proved this wasn't a fatal blow, but post-mortem damage, probably caused during mummification or by Howard Carter's team when they struggled to remove the golden mask, which had been fused to the mummy by hardened resin. So how did Tutankhamun die? The CT evidence suggests a combination of factors. He broke his leg shortly before death, visible in the scans as a fresh fracture. This injury became infected, causing blood poisoning. His malaria, genetic disorders, and weakened immune system meant he couldn't fight the infection. At age 19, the boy king died from complications of a broken leg, something that would be easily treatable today, but was often fatal in ancient times. In 2015, researchers at the University of Warsaw scanning Egyptian mummies in the National Museum in Warsaw, Poland, made an unexpected discovery. One mummy, cataloged as a male priest, showed something unusual in the pelvic region on the CT scan. Looking closer, they realized with shock that this wasn't a male mummy at all. It was a woman, and she was pregnant. Inside her body, clearly visible in the scans, was a tiny fetus, approximately 26 to 30 weeks old, about 7 months into pregnancy. This was the first and only known case of a pregnant ancient Egyptian mummy. The discovery raised immediate questions. Who was this woman? Why was she mummified while still pregnant? The mummy dates to the 1st century BC, making it about 2,000 years old. The wrappings and coffin indicated she was wealthy and important, though her name has been lost. Researchers named her the Mysterious Lady. CT scans showed she died between 20 and 30 years of age. The cause of death remains unknown, but pregnancy complications are likely. In ancient times, childbirth and pregnancy were extremely dangerous. Infection, hemorrhaging, or other complications could easily prove fatal. The fetus was never removed during mummification, which is unusual. Normally, embalmers would have removed it along with other internal organs. Perhaps the embalmers didn't realize she was pregnant. Perhaps there were religious reasons to leave the fetus in place. Or perhaps the death occurred under circumstances where normal mummification procedures weren't followed. The CT scans show the fetus in remarkable detail, its tiny bones visible, positioned as if sleeping. This tragic mummy provides a poignant reminder that ancient Egyptians, for all their monumental achievements, faced the same human vulnerabilities we do. Death in childbirth was common, and this woman and her unborn child were preserved together for 2 millennia, a frozen moment of loss that modern technology has now revealed. CT scanning has revealed secrets far beyond individual mummies. Large-scale scanning projects have provided statistical data about ancient Egyptian health, disease, and lifestyle across entire populations. Researchers have scanned hundreds of mummies and discovered that heart disease was common even in ancient times, with calcium deposits visible in arteries. Cancer has been identified in several mummies, including bone cancer and possible soft tissue tumors. Parasitic infections were nearly universal, with evidence of schistosomiasis, a disease caused by parasitic worms that still affects millions today. Dental disease was extremely common due to sand contamination in bread wearing down teeth. Arthritis affected both young and old, likely from physical labor. CT scans have also exposed fraud. Some elaborately wrapped mummies purchased by Victorian collectors turn out to be fakes, containing only sand, sticks, or random animal bones wrapped to feel like a body. Museums have been shocked to discover their prized mummies are actually empty bandages. The technology has also allowed reconstruction of faces with startling accuracy. By measuring skull dimensions and using forensic facial reconstruction techniques, scientists can create lifelike models showing what pharaohs actually looked like. King Tutankhamun's face has been reconstructed multiple times, showing a young man with a pronounced overbite and slightly feminine features. Ramses II's reconstruction shows a strong-jawed, hook-nosed man matching ancient descriptions. The future of mummy research will involve even more advanced technology.